Today, routine colon cancer screening starts at age 45. If you are over age 45 and have not yet had a screening colonoscopy, welcome to the club. Few people realize that colon cancer is now the #2 cancer killer in the U.S., second only to lung cancer. In fact, in non-smokers, colon cancer is America's #1 cancer killer. Even more alarming is the fact that colon cancer has been showing up earlier than it used to. Older adults still remain most at risk, but we have seen a steady rise in younger adults. This graph shows the dramatic rise of colon cancer affecting adults under the age of 50 since the 1960s. This is why, in 2018, national guidelines were updated to recommend screening colonoscopy starting at age 45 rather than 50. Here's the good news. You don't need symptoms. Screening works best when you feel perfectly fine. Here is a key point. There's a world of difference between detecting a cancer and preventing a cancer. Most cancers, such as breast cancer, prostate cancer, and lung cancer, are detectable, but not preventable. You have to have these cancers before your doctor can find it. Colon cancer is unique because it actually can be prevented. This is because colon cancer develops silently, starting as small benign growths called polyps. It can take many years for a small polyp to grow larger and then turn into colon cancer. The solution is simple. Find and remove the polyp before it turns to cancer, and the cancer is prevented. Unfortunately, polyps cause no symptoms, such as pain, bleeding, or other warning signs. By the time symptoms show up, it's often advanced colon cancer. It is best to be checked before any symptoms appear. That's called screening. This is why colonoscopy was developed over 60 years ago, to help your doctor find and remove any polyps before they become cancerous. Find and remove the polyp. Prevent the cancer. That's the miracle of colonoscopy. You may wonder why not choose the stool test you see advertised on TV, like Cologuard, or the newer Shield blood test. The key point is this. These tests are designed to detect colon cancer, not prevent it. They are meant to find cancer after it has already developed. For example, blood testing can detect many cancers, but it misses most precancerous polyps. Someday, stool and blood tests may reliably detect polyps, but that technology is not there yet. Colonoscopy remains unique because it allows us to find and remove polyps before they turn into cancer. That is prevention, and that is its real power. Let's talk briefly about the preparation or PrEP, because that's where most of the worry is. Good preparation directly improves your doctor's ability to detect and remove precancerous polyps. The preparation isn't painful and doesn't harm your colon. Its job is simply to clean things out temporarily so your doctor can see clearly. Most people find it inconvenient, not unbearable. Modern lower-volume PrEPs are much easier and better tolerated than they used to be. Most are now taken in split doses, with part taken in the evening before the exam and part in the morning of the exam. This improves comfort and, more importantly, improves the quality of the exam. The procedure is done in a specialized endoscopy unit in a comfortable medical setting by a team that does this every day. You are in good hands. No need to be embarrassed. They've seen it all. Just go with the flow and focus on the peace of mind you will have when it is all over. Under the care of board-certified anesthesiologists and certified registered nurse anesthetists, you're comfortably sedated for the procedure, which only takes about half an hour. Most people sleep right through it. It's one of the better naps you'll have this decade, and with modern anesthesia medications, the post-op recovery is quick. As mentioned, colonoscopy is not simply a diagnostic test. If a polyp is found, it can usually be removed during the same 30-minute exam. Here we see a typical precancerous polyp found during a routine screening exam before it turned to cancer. A wire snare is placed around the base and cuts and cauterizes the polyp. There's no pain and no bleeding. The polyp is then retrieved and sent for biopsy. Find and remove a polyp. Prevent cancer in a matter of seconds. Again, that's the miracle of colonoscopy. After the procedure, the recovery is quick, and you can resume normal activity the very next morning, knowing you've checked off one of the most important health decisions you can make. If your exam is normal and you're at average risk, you usually don't need another colonoscopy for 10 years. That's a decade of peace of mind. When polyps are found and removed, that information helps tailor the safest follow-up plan for you. The timing depends on your personal risk factors and what we find, including the type and number of polyps. A shorter interval, such as 3 or 5 years, doesn't mean something went wrong. It means screening worked and reduced your future risk. This is one of colonoscopy's strengths: personalized prevention, not one-size-fits-all. If you are over 45 and have not yet had a colonoscopy, ask your doctor, why not? Give yourself and your family the gift of peace of mind. Check it off your list so you can get back to the moments that matter.